Hi, my name is Adam Finelli. I'm a master's student in the Special Education Studies program, focusing on supporting students with moderate disabilities. I'm presenting today about enhancing student engagement and supporting the social emotional development of autistic students in secondary classrooms. I'm going to focus on describing a peer support approach to social skills training that the research shows can be effective for students with autism or students with autism and ADHD as a comorbid diagnosis. So the learning objectives for teachers participating in this workshop is to become familiar with techniques for modifying social skills training curriculum in order to manage the social anxiety experienced by autistic students according to their own report from their perspective, as they've shared with researchers. And this is also true, and especially true for students with a comorbid diagnosis of autism and ADHD. So, over the course of the presentation, I'll talk about what are the goals of social skills training for all students, what are the social characteristics of the population of students that we're trying to support, why are some programs missing the mark for our group of students we're trying to support that I'll call our target audience, and talk about what evidence-based strategies can be used instead. So the research I reviewed critically examined the content of social skills training curricula for adolescents with autism, ADHD, or comorbid diagnosis of both. The 6 peer-reviewed journal articles came from the researchers I list below. So Kristen Bottomabutel, a professor at Boston College, examined why some social skills training programs fall short of their goals. She centered the perspectives of autistic students. Iwano et al. 2020 conducted a study related to tracking eye movement in social situations for 73 autistic or autistic ADHD adolescents and their typically developing peers. She looked at imaging created by tracking the eye movement of adolescent students in social interactions of varying complexity and analyze this imagery that was made possible by advanced technology, particularly imaging technology that could sense activity in eye movements. And then Dean et al. 2020 compared two distinct models of group social skills interventions and the perceived social confidence of the participants upon exit. So he looked at two basic types of models. One was a model where explicit instruction in discrete social skills, they were taught explicitly by a teacher to a group of autistic students. They were all autistic students in this group intervention process. And although they were very engaged and reported learning new skills, they demonstrated these new skills with each other, but upon exit from the program, did not report feeling very confident or hopeful about socializing with typically developing peers. Alternatively, he looked at a type of intervention where autistic students were in a mixed neurotype group and had access to peer mentors who acted as a bridge to more expansive, naturalistic social environments. And they reported feeling much more confident and self-assured about being their authentic selves out in the world. Walsh et al. Conducted a scoping review of studies that used games as social skills training for autistic children and youth. And he basically looked at video games, virtual reality simulations, board games, and other types of interactive experiences for autistic students to be involved in a social interaction process in a kind of low stakes or simulated environment that allowed them to practice discrete skills either with a computerized agent or with other players online. And finally, Crompton et al., a series of or a group of researchers based in the University of Edinburgh, in Nottingham, England, and in Texas, right here in the US. They all conducted a study to gauge the success of a conversational information transfer process, otherwise known as a very formal, structured version of the game telephone, between autistic and non-autistic people, and showed that um, in both cases, the information transfer was relatively accurate, but when autistic students were working with other autistic students, they were able to build rapport a lot more quickly. So the key takeaways from this research are that a peer-mediated approach is the best approach to social skills training, right? It usually involves a mixed neurotype intervention where autistic students are gaining scaffolding to interact with their neurotypical peers. The researchers base their findings on the preferences of autistic students and their parents, and through referencing studies about how social interaction occurs. And studies into how social interaction occurs reveal it's really a two-way process in which both participants have to adjust to each other's styles. Another finding was that priority for autistic students is embracing their identities, proving self-advocacy. And thirdly, uh, the idea of typically developing peers being involved in the social intervention is the most effective form of an intervention for students who want to get better at interacting with their typically developing peers. So this method is preferred over instruction in which a teacher is utilizing kind of a rules-bound approach of imposing neurotypical social norms onto autistic students and not making it possible for them to be their authentic selves. What are the goals of social skills training? There are many detailed goals of social skills training. There are many studies into how we as humans interact and what is involved from a neurological point of view, from an emotional point of view. However, many of the goals, if not all, fall under a group of five social emotional competencies known by the Center for Academic and Social Emotional Learning as the CASEL 5. So these are self-management, self-awareness, social awareness, relationship skills, and responsible decision making. So for most students who have developed language skills, have a a willingness and openness to interact with others right off the bat. The journey towards these competencies is relatively smooth. Everyone's on a learning curve, but in general, they can go about this work of social emotional awareness building with relative ease. However, for autistic students, and especially for students who are dealing with many other underlying uh, conditions, mental health problems, stressors, due to ADHD and more that we'll get into, this can be a very fraught journey. It's very difficult and is often psychologically frustrating and draining. So, in order to teach these more discrete skills of, for instance, building awareness of social cues, making complex social concepts more accessible, um, teaching students how to make and keep friends and build romantic relationships, supporting a student's long-term career and life goals by building social competence that can be used in workplace settings as well as right there in school. What are the trends being used to implement the teaching of these skills? Well, applied behavioral analysis, peer-mediated interventions with modeling, role play, gamification of social skills training, video modeling. So with applied behavioral analysis, you're talking about discrete skills being broken down into steps through explicit instruction. And an example of a program that uses this would be one that is meant to produce short-term behavioral change uh, with the intention of remediating some kind of maladaptive behavior or helping a student understand how to handle social stimuli more effectively. Um, it can be based on the student's preference for what they want to learn, or it could be something the teacher thinks is good for the entire class. There are peer-mediated interventions, which essentially involve utilizing uh, an experienced peer who can give the student practice opportunities. There's role playing. So an example of that would be where you have professional actors writing and then staging scenes about social interaction between students. And adults are playing the students, but then they freeze and open up the floor to students in the workshop to take on the main character's role and demonstrate what they would do in a particularly challenging social situation, usually one that involves some interpersonal conflict or a moral decision, ethical decision, or decision about what the responsible thing to do is, especially without adults present. When it comes to the gamification of social skills training, we're talking about simulations, as I mentioned before, involving either a computerized agent or other online players where there is a strict rules-bound environment and students are either winning or losing in that simulated exercise based on a skill like tracking the speaker or responding with an empathetic comment based on the stimulus. Video modeling could be like the role playing model. It could be a sketch written by professional actors. Um, it could be as dry as CPR training, where you see a discrete skill again and again and you practice it, or it could be very creative and comedic and bring a social interaction that students are familiar with to life and kind of focus on how the characters think and respond. So examples of social skills training curriculum include um, programs that utilize many of the methods we just talked about, and they do so in such a way to mitigate the anxiety of participating at autistic students. Since theater was developed out on the West Coast, it was created by a former professional actor who realized that her acting training gave her insight into how students with autism might be able to act out their authentic selves in a low stakes, structured environment using improvisational exercises, using dance, using poetry, and including trained peers who are neurotypical, who are taught about the social characteristics of autism to act as guides through this drama therapy process. The outcome that's hoped for is a building of self-esteem and confidence to be their authentic selves out in the world. The social thinking methodology developed by Michelle Garcia Winner is very language-based, and it's a thinking-based methodology that encourages metacognitive thought. In other words, students aren't just learning social skills rules for the sake of it. Instead, they're thinking about when and why to employ social skills and to think about their own thoughts based on other people's behavior and how their own behavior make other people have their own thoughts. The social thinking methodology is designed for individuals 4 through adult with solid language, cognitive, and learning abilities. However, the creators have revised their curriculum recently with an understanding that they want to be more inclusive to all participants and really understand what each participant individually wants to learn and really modifying the content based on where they are cognitively with their learning abilities, etc. So they've really evolved with a lot of the research featured in this program. Peers for Adolescents is a evidence-based program that's clinic-based. It's a 16-week program, um, and it's designed to support motivated youth in making and keeping friends. Rehearsal for Life Urban Improv is the professional actor intervention that I mentioned earlier. Uh, the writers and performers cater each workshop to an individual school, and they involve students in the role-playing process in a very skilled and fun way that I've seen live, and it's terrific. All right, if you're participating in this workshop, which ones are you familiar with? Or share more in the chat if there's one you want to share we may not know of. So what are the social characteristics of students who participate in SST? Well, anyone can participate in social skills training, and anyone in the school could be on the left. We have the green group. It's connected students who are either neurotypical or just are part of the mainstream social culture of school. They may have specific learning disabilities, but overall, they have plenty of opportunities for social interaction during the school day and then when they leave the school building. Plenty of opportunities for social interaction, plenty of social connection, plenty of confidence. In the middle, in yellow, we have outgoing autistic students. They could be fine associating with their autistic peers and have a close group of friends. They could also have an interest in being very outgoing with neurotypical peers, and they could just be facing a high rate of rejection due to how they're perceived by those peers based on their distinct behaviors and social environments, the way their brains process their sensory environment, and what they do with their bodies, with their minds, with their thoughts to manage their anxiety and to adapt to uh, their their sensory environment. So, for example, stemming, or maybe they are students who talk on and on about a specific topic, and this makes it hard for students in the green group to feel like they can easily reach out and make attempts to interact with them. On the right are the students we really want to focus on helping. They're students experiencing social isolation who are autistic and, get more specific, why are they experiencing social isolation? Why are they not having opportunities to practice what they may learn in the social skills class? So the social characteristics of the group that is our quote target audience are social characteristics that are affected by comorbid diagnosis of ADHD that increases anxiety and depression. They could have the usual struggles that adolescents have with communication and socialization, but those troubles are those hardships are exacerbated by uh, their anxiety, their depression, their ADHD, things that accompany being autistic that really, really exacerbate the social cognitive uh, deficits or differences that make interacting with the mainstream group or even the yellow outgoing autistic group very difficult. They could have pre-existing negative experiences with peers. They could have very low self-esteem and heightened feelings of loneliness. They could be closely followed by a paraprofessional or utilize technology that's very visible and increases the potential for stigmatization of themselves as an autistic individual. And that affects how they're perceived and affects their opportunities for social practice. There is a doctor who's also an online personality. He has a Facebook page dedicated to what he calls ADHD. That's a combination of autism and ADHD. His name's Kojo Sarfo, and he just posted this month. Here are two graphics that illustrate the social characteristics of someone of an autistic person, an ADHD person, most likely an adult, and someone who has, quote, ADHD. So right now in the chat, if you had to relate to the blue graphic or the orange graphic, which would you pick? All right, and then at this point in the workshop, we talk about we'd have some people share out whether or not they recognize these characteristics in themselves or any of their students and how that affects their social lives or the social lives of their students. Why and how are some of these social skills training programs missing the mark for our group, especially students who are socially isolated? According to Professor Kristen Bodema-Butel in 2021, she says some of the activities within popular social skills training programs, particularly ones that rely on the ABA model to achieve their ends, promote behavioral control and normalization instead of promoting agency. And again, agency is something that autistic students who are adolescents in these studies have reported they want more than anything in a social skills training experience. So in order to give them that agency, in order to center their preferences and give them choices about what social skills they want to attain, and to make the whole experience one that allows them to take their skills out into the world and have practice opportunities with typically developing peers or with whomever they want to have practice with, need to look back to these long-standing theories of education that really promote authentic engagement. One is Jean Piaget's constructivist learning theories. This is a theory that social interaction is key to the learning process. It is in social interaction that we ask questions, we investigate, we interact with others, then we reflect on these experiences and grow cognitively as a result. And the cycle repeats. Kolb's experiential learning cycle is also a circular or cyclical process. It's about acting and experiencing the world, then later reflecting, thinking about what you encountered, what you didn't know at the time. Think of it as going back to the drawing board and then getting ready to act again, coming into contact with the world through direct experience, realizing what you don't know, what you wish you knew, going back, reflecting, thinking, looking things up on Google, looking things up in the dictionary, educating yourself, synthesizing what you've learned, getting ready to act again. Zones of proximal development states that students learn best when in active collaboration with the quote, more experienced other. So in this case, that would be the peer who can be paired with an autistic student and really provide that zone of proximal development and that support to help take an autistic student from where they are to where they want to be relative to a social skill. So, what evidence-based strategies can teachers use to help autistic students balance adaptive skill attainment, to help mitigate anxiety, to help with any immediate concerns based on their parents' wishes or what their teacher thinks is best for them, right? But also balance that with the development of authentic expression based on who they are and what they're really interested in. So one example comes from research done at the University of Edinburgh, and leading that research, or one of the leaders, is Catherine Crompton, and she and her team have been researching how social interaction occurs between autistic adults and also between autistic adults and neurodevelopmental adults. So her team has a toolkit of resources. I'm sharing some images from those resources here. Her goal is to develop a system or program at school that allows autistic students to lead their own group, create an environment where there's inclusivity, there's the chance for true, authentic self-expression, and the chance to invite peers from around the school into their club so that they can educate others about autism and also form that two-sided conversation where people have a chance to adapt to each other's communication styles and bridge uh, neurocultural differences. So the toolkit includes plenty of resources for teachers to help facilitate these meetings, to volunteer to support them, includes a list of readings for students and teachers where the main characters have autism or are neurodivergent. And it's not the only program like this. There are many others that I will share as part of this workshop. They come from organizations like the Wellesley Centers for Women, Open Circle, and there are others too. There's Catherine Faraday. Her work with the TEACH program has resulted in handouts that allow teachers to create what are called communication contracts to establish an understanding with students, such as students with autism, where there's a very different communication style, and both conversation partners need to give up a little of what they're used to as communicators, but also meet the other person halfway and hopefully learn. Are there any questions? It's my bibliography. Thank you for your time.